Dear student, I greet you. I am Dr. Gülnara İbrahimova from Department of Pathological Physiology of Azerbaijan Medical University. I want to explain the topic Pathology of Immune System and Allergy. The immune system protects the body from various pathological factors. Immune system activity is disturbed in all pathological processes and diseases. The rate of the immune system makes the organism helpless against the microorganism and other pathogenic factors. Disturbances in the immune system functions have a bearing even on the development of the malignant tumors. The pathological states which are connected with the weakness of the organism immune system are called immunity deficiency states. Immunodeficiency states is genetically defective immune system and disorders of protect the body against effect of antigens. Immune deficiency are divided into primary and secondary. Immune deficiency occurring under the influence of external and internal factor. External factor, for example, radiation factor, chemotherapy, infection factor, and malnutrition, and etc. And internal factor, hypoxia, nephrotic syndrome, uremia, and etc. Each cell originates in the bone marrow. For example, a stem cell produces B cells. Stem cell to mature immunoglobulin secretion plasma cell. If the formation of plasma cells is disturbed, then immunoglobulins aren't formed. And immunodeficiency syndromes and primary form has several types: cellular, humoral, and mixed type. And in the cellular type, disorders of T cell formation. T cell responds to humoral immunity. There are Merkel syndrome and Dijor syndrome. In the Merkel syndrome, form achondroplasia. In the Dijor syndrome, form thymic hypoplasia. And in the humoral type and disorders of B cell formation, B cell respond to humoral immunity. And there are Breton syndrome and West syndrome, and the disorders formed gamma globin and form hypogammaglobulinemia. And mixed form, there are Glassman-Wiener syndrome and Lewy-Body syndrome. In the Lewy-Body syndrome, form ataxia telangiectasia. And primary immune deficiency diseases, lymphocytes development and sites of block in primary immune deficiency diseases. The affected genes are indicated in parentheses for some of the disorders: ADA, adenosine deaminases, and CD4TL, and maybe form syndrome, common variable immune deficiency. Next, severe combined immunodeficiency. Secondary form and acquired immune deficiency syndrome, infecting again is a virus, immunodeficiency virus, and there are injury of T helper 1 and T killer aren't activated, because if T helper 1 isn't activated and T killer aren't activated and T helper 2 is injured, the function of B lymphocyte is broken. Synthesis of interleukin-2 interferon gamma is decreasing. And very interesting slide, and pathogenesis of virus infection, or for example HIV. Initially, HIV infections, T cells and macrophage directly or is carried to the cells by Langerhans cells, and viral replication in the original lymph nodes leads to viremia and widespread seeding lympho tissue. The viremia is controlled by the host immune response, and the patient then enters a phase of clinical latency. During this phase, viral replication in both T cells and macrophage continues unabated, but there is some immune containment of virus. There continues a gradual erosion of CD4 cells by productive infection. Ultimately, CD4 cell numbers decline, and the patient develops clinical symptoms of full-blown AIDS. Macrophage also paralyzed by the virus early, and they aren't lyzed by virus, and they transport the virus to tissue, particularly the brain. And a virus connected or behind the T cell forms 3 group cell virus replication in inducted CD4, and other activation of uninfected T helper, expression of virus peptides on infected T helper, finally form and these of infected cell. Next, activated induced cell death and form apoptosis. Next, killing of infected cells by virus by T killer. AIDS virus affects some cell, and in time disorders function of T helper or CD4 T cell, CD4 T cell deficiency, and decreasing cellular immune reaction, and B cell activation abnormal, increasing of infection with extracellular and intracellular pathogenesis, decreasing of macrophage activation, and interleukin-2 interferon gamma deficiency, and persistent tumor cell is decreasing, maybe from tumor tissue. Allergy, high sensitivity of the organism to the action of infection against or some substance of antigenic nature. Allergy is a pathological form of the immunogenic reactivity. Allergy is a pathological form of the immunogenic reactivity at which the disorders of its sensitivity to repeated antigen exposure. Allergens have several types, for example, exogenous and endogenous allergen factor, exogenous allergen factor, non-infection factor, and infection factor, and endogenous allergen factor, and natural factor, and acquired factor, and acquired factor following non-infection factor and infection factor. Classification of hypersensitivity by several famous men. And first type, atopic reaction, second type, cytotoxic reaction, third type, immunocomplex type, and first type, and delayed type of T-cell mediated hypersensitivity. And there are, we say, diseases that are related to this allergic reaction, and there are 4 types hypersensitive reaction, and we see disorders and immune mechanism and pathological lesion form. Next, stage of allergic reaction reaction has immunogenic stage and pathochemical stage and pathophysiological stage. And all three types of allergic reaction are immediate reaction, and B lymphocyte is take part, but type for allergic reaction, delayed reaction, and T cell is take part. And there are stage sensitization and immunological stage, and chemical stage, and pathophysiological stage. And there are active and passive sensibilization. Active sensibilization is formed when allergen enters the organism. Passive sensibilization is formed when an active sensitized blood serum is injected in another organism. The body receives the antibody ready, and there are monovalent sensibilization, polyvalent sensibilization, and cross sensibilization. Monovalent sensibilization and hypersensitivity of organism only to one type of antigen. Monovalent sensibilization, hypersensitivity of the organism to several allergen at the same time. Cross sensibilization in the organism sensitized by one allergen, hypersensitivity to another type of allergen is formed. An allergy occurs when an allergen enters the sensitized body for the second time. And the following said about it: allergic stage and immunological. In the immunological stage, after enter in the antigen in the body, form against antibody. Next, complex formation, antibody and antigen, and antibody antigen complex absorption in the cell membrane. Next, degranulation mast cell, releasing of several biological activity element or mediator, and lysosomal enzyme activity and output in the cytoplasm. And this process is called pathochemical stage. After this mediator influence in the organ and system, increasing vascular permeability and falling blood pressure, spasm, smooth muscle of the bronchi, disorders function of organ and tissue, maybe form autolysis of cell. This stage is called pathophysiological stage. And allergic reaction of the first type and anaphylactic reaction. The formation of antibodies, mainly IgE, and the release of vasoactive amines and other mediator from basophil and mast cell. The involvement of other cell activation of inflammation. The clinical type anaphylactic shock and atopic bronchial asthma, pulmonosis, and urticaria and eczema. First type atopic reaction. The pollen antigen is captured by the dendritic cell, and information about the antigen is transmitted from the antigen presented cell to the T helper 2. T helper 2 is activated and the mediated is eliminated. T helper 2 secretion interleukin 3, 5, and granular macrophage colony stimulation factor. This mediator influence in the eosinophil. And next, secretion from T helper to interleukin 4. Interleukin 4 influence in the B cell. B this cell is activating and secretion antibody connected with antigen, and antibody primary connected with receptor. For receptor situated in the mast cell, activate mast cell and disorders membrane mast cell, disorders vesicle mast cell, and secretion primary mediator after secondary mediator influence in the organ and system and form disorders. In the pathochemical stage, and one antigen connected with two antibody and IgE. Each antibody have one receptor. This receptor is called Fc, and after disorders of membrane mast cell in time activate enzyme phospholipase A2, and each cell has vesicle in the cytoplasm. If activate macrophage, activate vesicle and break down vesicle, secretion primary mediator, for example histamine, protease, and hematoxis factor. And if disorders membrane of mast cell after influence enzyme and form arachidonic acid and PAF, and activate platelet and secretion prostaglandin D2 and leukotriene B4, C4 and D4, and these mediator influence organ and system and maybe form vasodilation, vascular leakage, and smooth muscle spasm. And this process is called immediately process, and form late phase reaction in time infiltration of leukocyte and epithelial damage and form bronchospasm. We see disorders that are related to this allergic reaction and type 1 hypersensitivity. We say and secretion mediator histamine, PAF, leukotriene C4, D4, E4, and other mediators. This mediator influence in the vessel and form vasodilation, increasing vascular permeability, and other mediator influence in the muscle, form spasm of smooth muscle, and cytokines and leukotrienes B4 and other mediator influence in the cellular and maybe form cellular infiltration. Anaphylactic reaction, anaphylactic shock develop in first type hypersensitive reaction. I won't explain this. Anaphylactic reaction occur in the all warm-blooded animals. In cold-blooded animals, only under certain condition anaphylaxis-like change may be observed. The clinical examples of anaphylaxis may be of two types, general type and local type. Local anaphylaxis may include bronchial asthma, allergy, rhinitis, and ovaries phenomena, and etc. Anaphylactic shock may be accused the influence of medicinal preparation and prophylactic vaccines. In the development of anaphylaxis, 3 periods are distinguished: and sensitization period, anaphylactic shock period, and desensitization period. For active sensitization, a small amount of horse serum, and for example 1 milliliter injected often subcutaneous in guinea pig, sensitivity develops 10 and 14 days later, antibodies are formed against horse serum antigens in the organism of guinea pig. Hypersensitivity is returned for a long time, up to 2 years. And for produce of anaphylactic shock, a high doses of horse serum 10 milliliter injected intravessel in the guinea pig. The first syndrome of anaphylactic shock appear 5 and 1 minutes after the injection. If the animals come out of the anaphylaxis shock, a period of desensitization occurs. During this period, the body doesn't respond to any infection. This period lasts 2 or 3 weeks. In the anaphylactic shock formation antigen-antibody complex, this complex absorption in the mast cell and basophils and release biological activity element or mediator influence in the vessel in the other organ and system and form disorders, dilation of arterioles, increasing vascular permeability, and mucous formation is lowered, spasm of bronchus, and drop in blood, next drop in blood pressure, and pulmonary ventilation disorders. Next, disorders of microcirculatory, and from hypoxia, finally respiratory and cardiovascular disorders, and finally death of the organism. Anaphylactic shock isn't formed in the antigen, is injected into the body in small doses during 4-10 days. This process is called desensitization. Mechanism of the to hypersensitivity reaction or cytotoxic reaction. There is a synthesis of antibodies IgG1, 2, and 3, IgM, binding of the antigen on the surface of target cell, phagocytosis of lysis of target cell with activated complement and killer cell. And there are cytotoxic reaction, several type, and or 3 process are observed, and phagocytosis process and complement dependent cell lysis, and antibody dependent cell lysis, and next and mechanism of type 2 hypersensitivity, and antigen on the target cell bind with antibody and are destroyed. Complement mediator lysis, phagocytosis by macrophage in the tissue, neutrophils mediator immune disorders, antibody-dependent cell mediator cytotoxicity, and apoptosis of target cell is induced by granzymes and perforin produced by natural killer cells, and interaction of fast ligand on the surface of natural killer cells with fasten the surface of target cells. Modulation or blockage the normal function of a receptor by receptor antibody. This example of mechanism depicts and myasthenia gravis, in which acetylcholine receptor antibodies block acetylcholine from attacking to its receptor on the motor and platelets of skeletal muscles, thereby impairing neuromuscular transmission and causing muscle weakness. Complement component and C1, complement 3B, complement fragment produced from complement C3, which act as an optioning, and complement 5A, complement fragment produced from complement 5, which acts as a hematoxis factor for neutrophils. And FC gamma receptor, cellular receptor for the FC portion of immunoglobulin G, FC receptor. This slide very interesting, and the mechanism of type 2 hypersensitivity. I want to explain this hypersensitive reaction again. And the reaction has three mechanisms: phagocytosis and complement-dependent cell lysis and antibody-dependent cell lysis. In the phagocytosis mechanism, phagocytes that activated after form phagocytosis of abnormal cell. Next, complement activated and complement produce and complement fragment 5A and 3A, and other neutrophil enzymes is elimination and reactive oxygen intermediate elimination, and inflammation and tissue injury formed. Next, antibody dependent cell lysis. In time, antibody against thyroid stimulation hormone receptor, antibody connected with this receptor, and thyroid stimulation hormone don't connected on receptor, and in time antibody stimulated receptor without hormone may be from other diseases of thyroid organs. And next, antibody connected with receptor for acetylcholine, and there are antibody inhibit binding of neurotransmitter to receptor. We see diseases that are realized to this allergic reaction, and there are diseases including type 2 hypersensitive reaction, target antigen and mechanism of diseases, and clinical pathological manifestation. Mechanism of type 3 immunocomplex hypersensitivity, synthesis of antibody IgG, IgM, the formation of complexes antigen antibody, and this complex is formed in the liquor, and complement activation, the participation of neutrophils, release of lysosomal enzyme from damaged cell. Very interesting slide. And immune complex form in the blood and from circulating antigen and antibody. Both small and large immune complexes are removed successfully from the circulation and do not cause tissue damage. Intermediate size complex are deposited in certain target tissue in which the circulation is slow or filtration of the blood occurs. The complexes activated the complement cascade through complement 1 and generate fragments including complement 5A and 3B. And complement 5A is a hemataxis for neutrophils which migrate into the inflamed area, attack to the IgG, and complement 3B in the immune complexes. The neutrophils attempt unsuccessfully to phagocyte the tissue, and in the process release a variety of the degradative enzymes that destroy the healthy tissue. Receptor of FC gamma in the cellular receptor for the receptor Fc portion of immunoglobulin G. Next, and the same slide, very interesting slide, and form complex in the liquor and deposition this complex in the tissue, in the vessel wall, and damage vessel wall, maybe form vasculitis, and neutrophil lysosomal enzyme releasing and disorders of wall of the vessel, maybe form diseases. And example of immune complex mediator disease, we see and several disease and antigen involved and clinical manifestation. And next, mechanism of type 4 hypersensitive reaction, the formation of sensitized T lymphocyte or T killers, and the release of lymphokines. Antigen from target cell stimulated T cells to differentiate into cytotoxic T cells, which have direct cytotoxic activity, and helper T helper 1 cell involved in delayed hypersensitivity. The T helper 1 cell produce lymphokines, especially interferon gamma, that activate the macrophage through specific receptor, for example, interferon gamma receptor. The macrophage can attack to target and release enzyme and reactive oxygen species. That are responsible for most of the tissue destruction, and the same slide, very interesting slide, and delayed type hypersensitivity. In time T helper connected with antigen presented cell, and next T helper activate and secretion cytokine, and cytokine influence in the other cell and destroy cell. And next type, and T killer activate, and after activate T killer directly kills and other cell and tissue. T helper doesn't kill directly. Primary T helper secretion cytokine, and cytokines kill directly, and T killer kills directly. Formation of granulomas during first type of hypersensitive reaction, if the antigen cannot eliminate, chronic inflammation and or granuloma is formed. Section of the lymph node shows several granulomas, each made up of an aggregate of epithelial cells and surrounded by lymphocytes. The granuloma in the center shows several multinuclear giant cells. The events that gives rise to the formation of granulomas in type and first hypersensitive reaction. Note the role played by T cell derived cytokines. Next, development of contact dermatitis, and very interesting slide, and watch influence in the skin, activate immune system, and and Langerhans cell activated, and phagocytosis and processing of antigen and formation antibody, migration to regional lymph node and transformation into dendrit cell, and collection of antigen specific T cell, and after presentation and proliferation and differentiation of T helper 1 and T helper 1 circulation in the blood system, and to size of antigen exposure, and this activate T helper 1 secretion several mediator influence monocyte and macrophage activate this cell, and this mediator influence in the skin and change normal structure of skin and maybe form contact dermatitis. And there are example of the T cell mediator type 4 hypersensitivity. We see diseases that are relate for this allergic reaction, and diseases, and there are several diseases, and specificity of pathogenesis of T cell and clinical manifestation, mechanism of transplant rejection. Transplant rejection is frequently observed in heterotransplantation and even in homotransplantation, and recognizing and rejection of organ allografts. And there are direct pathway and indirect pathway. In the direct pathway, donor class 1 and 2 MHC antigen on antigen presenting cells in the graph are recognized by host CD8 cytotoxic T cells and CD4 helper T cells, and respectively, and CD4 cells proliferate and produce cytokines which induce tissue damage by local delayed hypersensitive reaction. CD8 T cell responding to graph antigen differentiate into T killer cells that kill graph cells. In the indirect pathway, graph antigen are displayed by host antigen presenting cells and activate CD4 T cells which damage the graph by a local delayed hypersensitive reaction and stimulate B lymphocyte to produce antibodies. Mechanism of pseudo-allergy, the release of mediator of allergy from mast cell under the influence of environmental factor rather than as a result of damage to the complex antigen and antibody, disorders of metabolism of polyunsaturated fatty acid, arachidonic acid, and controlled complement activation due to hereditary defense of complement fragment 1 inhibitor of the complement system. Mechanism of immunology, tolerance, the stage of organism inability to the immune response is called the immunogenic tolerance. The body doesn't respond to own antigen. Mechanism of immunology tolerance have physiological, pathological, and artificial form. Physiological tolerance has a central and peripheral form. Central form, autoreactive T and B cell must be destroyed in the central organs, for example, thymus and bone marrow. If T and B cells aren't destroyed in the central organs, they pass to the peripheral way, and in the peripheral form have energy, suppression of regularity lymphocytes, and apoptosis. And they explain this slide. The T cells aren't activated and don't respond to the body antigen. This process is called energy, and regulatory T cell secretion, suppression, a substance, for example, interleukin-10, TGF-beta, they slow down the maturation of T killer cell, a natural killer. They don't respond to the body's antigen. This process is called suppression. And next, apoptosis of regulatory T cell. Pathological tolerance, and the body's immune system doesn't respond to foreign antigen, to a virus, bacteria, tumor cell, and etc. Causes of pathological tolerance and following immune deficiency state, increasing activity of T suppresses cell, inhibition or blockage of cellular immunity reaction, cytotoxic T cell apoptosis, and tumor cell have a Fas ligand. This ligand bind to the receptor of Fas of cytotoxic T cell, and apoptosis of T cell absorbed. Next, artificial tolerance. Artificial tolerance and occur during the determination of radiation factor and ionization factor, if cytotoxin, if the organism takes cytotoxin drug, and etc. Autoallergy is a state in which the organism immunity system fails to distinguish between self and non-self and react by formation of antibodies against one's own tissue. So autoallergy is the opposite of immune tolerance. Classification of autoallergic or autoallergic have primary and secondary form, primary natural and secondary acquired, and the lens follicles of the thyroid gland and nervous system and ovaries and internal ear, and secondary allergen, non-infection factor and infection factor, and no infection factor have two type complex, and the intermediate factor damage to product tissue by microbe. Autoimmune diseases occur during heredity predisposition and previous infection and disorders of immunological tolerance mechanism. Pathogenesis of autoimmunity. Autoimmunity arises from many causes, including the inherence of susceptibility genes that may interface with self-tolerance, and environmental triggers. Triggers may be inflammation and other inflammatory stimuli that promote lymphocyte entry into tissues, activation of cell-reactive lymphocytes, and tissue injury. And a very interesting slide, this slide, and microbe influence in the cell, activate self antigen, and self T cell activate, T cell connected with antigen presenting cell expresses and costimulatory molecules and disorders on on tissue and cell, and next molecular mimicry and microbe influence in the cell and form activate microbial antigen and self-reactive T cell that recognizes microbial peptide, activate T cell, and T cell influence self-tissue and damage on tissue. There are organ-specific and tissue-specific autoimmune disease. Organ-specific autoantibodies often activate against other organ, maybe influence and other organ influence in the adrenal cortex, pancreas, and stomach, and thyroglobulin, and maybe form myasthenia gravis and idiopathic Addison disease, diabetic mellitus, and several gastritis and Graves' diseases and Hashimoto thyroiditis. And next, tissue-specific autoantibodies against and influence in the kidney and disorders basal membranes and in the lung system and disorders alveolar membrane, maybe from glomerular nephritis and pulmonary bleeding, and form finally Goodpasture syndrome. And there are autoimmune disease. We see diseases that are related to this disease, autoimmune disease, and organ-specific disease and systemic disease. Organ-specific disease and systemic disease.
Extreme conditions, general, severe, dynamic conditions of the body occurs under the influence of extreme factors, pathological processes developed in the organism that extremely activates adaptation mechanism and disturbs vital activity of organism. Periods of disturbance of vital activity during action of extreme factors. The body is affected by pathogenous factors, then from extreme states, terminal states, next clinical death and biological death. Extreme states occur under influence extremely strong stimuli of external and internal conditions, characterized by overstrain or breakdown of the organism adaptation mechanism that lead to the destroying of vital activity and may lead to the death. Manifested by activation and depletion of adaptive mechanism, impaired body function, deviation in the parameter of hemostasis, require urgent medical intervention. Stage of extreme states and have several stage and primary stage, secondary stage, and third stage. In the primary stage, activation of adaptation reaction, activation of sympathadrenal and pituitary system, influence of injured factor, changes of hemostasis, development of stress reaction. And the next stage, insufficiency of adaptation mechanism, increasing of level of disturbance in the organism, overstrain and exertion of adaptation reaction. And third stage, extreme regulation of vital activity, following deepness of injury in all function of organism, and next progressed insufficiency of adaptation mechanism. And a change in the body in extreme condition form hypoxia, metabolic disorders, increasing synthesis and increase in blood biological active substance, violation of microcirculation, violation of the hemodynamic of the body, violation of the central nervous system, cardiac, respiratory, gastrointestinal tract, and etc., violation of the body vital activity, development of the vicious cycle, and terminal state development. And the main type of extreme condition: collapse, shock, and coma. Collapse is an acute vascular insufficiency characterized by a drop in arterial and venous pressure and a decrease in the mass of circulation blood in the vascular system. The difference between collapse and shock. Shock begin with a neurogenic mechanism, and collapse is a vascular insufficiency. All type of shock include a collapse process, and collapse never involves a shock component. Shock the nervous system and collapse the vessel are distinguished. And type of collapse by pathogenesis, and there are cardiogenic collapse and hypervolemic collapse and vasodilation collapse. Cardiogenic collapse and form post-infarction, cardiac tamponade, cardiomyopathy. Hypervolemic collapse form post-hemorrhagic and dehydration and etc. Vasodilation form hyperthermic. The action of biological activity, substance, toxin, and etc. Classification of collapse according to the clinic, and a hemorrhagic collapse and develop with massive blood loss. Circulatory hypoxia is observed, then mixed hypoxia occurs. Next form a pancreatic collapse, toxic infection collapse, and orthostatic collapse. And compensatory mechanism used to maintain circulatory function and blood volume in hypovolemic shock, in acute bleeding or other conditions leading to decreases in blood volume. In time increase activity compensatory mechanism, and mechanism to maintain cardiovascular function, mechanism to maintain blood volume, and increase heart rate and cardiac contractility, and increase activity of hypothalamus, secretion antidiuretic hormone, and after increasing of function, liver function, and mobilization of blood in the liver, activate renin, angiotensin, and aldosterone mechanism, secretion aldosterone influence in the kidney, and sodium and water retention in body, and vasoconstriction of the peripheral vessel in skin, in other organ, finally decreasing urine output. Shock, the general extremely severe condition of the body, occurs under the influence of destructive factors and develop in several stages, is characterized by the decreasing blood supply of tissue, hypoxia, supply of weakened vital function. More deep change occur in the activity of the central nervous system, endocrine system, as well as in the general and local blood circulation, disorders, respiration system, and metabolism. Classification of shock, and have pain shock, humoral shock, and psychogenic shock. Pain shock have two types, endogenous and exogenous. Exogenous have trauma, burns, frostbite, and electric trauma, and endogenous and cardiac shock and nephrogenic shock, abdominal diseases shock, and humoral have two types, and transfusion shock and anaphylactic shock. An exception of cardiogenic shock is tachycardia in the torpid stage, in blood transfusion shock under the influence of an antigen-antibody complex, and red blood cell hemolysis, and coagulation decreases, and hemorrhage is observed. Dynamic of movement of shock. The figure shows the stage of shock. In the erectile phase, all indicators increase, while in the torpid phase, they indicate decrease. Erectile stage increase arterial pressure, heart rate is increasing, spasm of coronary vessel, and etc. In the torpid stage, decreasing all indicated activity and decreasing arterial pressure, decreasing and blood volume, and decreasing and activity nervous system, and etc. Shock mechanism. Shock includes the following mechanism and neurogenic mechanism. In time, the central nervous system is activated, then inhibition is observed. Next, microcirculatory mechanism. Hemocirculation is disturbed, and spasm of capillary vessel, change permeability of vessel. Next, acapnic mechanism. In time, drop in carbon dioxide in blood. The gas composition of the blood is disturbed due to respiratory distress. Next, toxemic mechanism. By the release of lysosome enzyme first into the cytoplasm and then into the bloodstream, and by the digestion of the smooth muscles of the vascular wall itself. Next, the formation of shock lungs and form atelectasis, pulmonary edema, and impaired microcirculation. And next, the formation of shock kidney, impaired blood supply of the kidney, and maybe form uremia. And form shock of lung system and spasm of post-capillary. Next, increased coagulation of blood in lung vessel, increasing permeability membrane of capillary, disturbance microcirculation, form hypoxia of tissue, and finally disorders normal function of lung system. Edema form and atelectasis form in the lung system, in the lung, and finally form shock of lung system. Next, shock of kidney and pathological agent factor influence in the body, spasm of post-capillary of kidney, decrease of blood in kidney, and change normal function of kidney, and glomerular filtration rate is decreasing, maybe from finally uremia. Finally, uremia. Coma is a general extremely serious condition of the body, accused under the influence of a pathological factor, is characterized by inhibition of nervous activity, loss of consciousness, hypo and areflexia, insufficiency of the function of organs and system of the body. And the main types of coma, and for example, diabetic coma develops in violation of diet and insulin therapy, hypoglycemic coma, and overdose of insulin of absorbed, hepatic coma, accused with total damage to the liver parenchyma, and normally ammonia is neutralized in the liver and turns into urea. With liver pathology, ammonia increases, and renal coma develop with uremia. Next, malaria coma observed in violation of red blood cell by the breakdown product of malarial plasmodium. A clumping coma occurs with toxicosis of pregnant women. Anoxis coma develops with a sharp decrease in oxygen in the inhalation air. Apoplexy or hemorrhagic stroke is the result of massive hemorrhage in the brain. The patient suddenly loses consciousness. During an ischemic stroke, coma develop gradually. Next, adrenal coma develops with adrenal insufficiency. Cytotoxic coma develops with hyperthyroidism, and a hyperchloremic coma may occur as a result of indomitable vomiting with toxicosis of pregnant woman develops gradually. And stage of coma have several stage, for example, initial stage, second stage, and third stage, and first stage. And initial stage characterized by cyclical disturbance, destroying of coordination of movement, and some change in the electroencephalogram. And next stage and characterized by sleepiness and disturbance of consciousness, hyperdynamia, decreasing of reaction to the external irritant, as well as to the pain. And third stage characterized by development of sopor state, inhibition of cyclical activity, weakening, and a partial loss of the consciousness, reaction to the only very strong stimuli. In this page, very deep change of electroencephalogram. And final stage, deep coma, characterized by complete loss of the consciousness, eye reflection, and loss of corneal and pupil reflexes, decreasing of the arterial pressure, arrhythmia, respiratory destroying at the respiration, drop of body temperature are absorbed due to destroying of central nervous system. And stress and genetic adaptation syndrome. Stress or genetic adaptation syndrome is the totality of the non-specific reaction with rise under the influence of different pathological factor or stressor, and serve for adaptation of the organism to the action of the disease factor. Stress is a typical or non-specific reaction of an organism to an extreme stimulus. At the same time, the hypothalamic pituitary adrenal system is activated. The body adapts to new conditions, but a pathological condition associated with a violation of regulatory processes developed. Eustress and distress reaction is observed. With an eustress reaction, the adaptive ability of the body is mobilized. The body adapts to a change external environment. Strong and persistent stress factor form a stage of distress in the body. During stress, the cilia tract is formed. For example, hypertrophy of the adrenal cortex, involution of the thymic lymphatic apparatus, and thymus, spleen, and lymph node disorders, neutrophilic leukocytosis, eosinopenia, lymphocytopenia are observed. The formation of hemorrhagic ulcers in the digestive tract system, and stress increased adrenaline in the body, and then hypothalamus increasing and increasing secretion of liberine. Next, increasing on adrenocorticotropic hormone. Next, increasing cortisol, and this hormone influence in the bone marrow. And next, increasing neutrophil. Next, decreasing eosinophils and lymphocytes. Stage of stress reaction. There are and several stage, and alarm stage in time activation of the adrenal cortex, then thymus, spleen, and lymph nodes. Next, resistant stage, and increasing the body's resistance to stressful effect. Hyperfunction and hyperplasia of tissue and organs are observed. Next, exertion stage, there are nervous and hormonal regulation is disturbed. As a result, the general resistance and adaptability of the body decreases. Its vital activity is injured. There are three stages of adaptation syndrome by cilia, and a stress factor influence in the body, and from alarm stage. Alarm stage has two type, shock and anti-shock. Shock phase, decreasing activity all parameter, and hypertension, hypothermia, central nervous system depression, microcirculatory disorders, the prevalence of dissimulation over assimilation, and anti-shock phase, increasing activity, and hypertension, hyperthermia, central nervous system activation, prevalence of assimilation over dissimulation, and stage of resistant compensation of injury function and recovery of weakening of the body's reserve capabilities, development of stage, and finally depletion stage, depletion and death of the body. And mechanism of the stress and extraordinary stimuli influence in the organism. Primary activate hypothalamus secretion, releasing factor, and increasing and rate adrenocorticotropic hormone. After this hormone influence adrenal system and secretion adrenaline, and finally how change of function organ and system during adaptation and influence extraordinary stimuli. Pathogenesis of general adaptation, the same slide and very interesting slide. After activate hypothalamus and secretion and releasing factor, this factor influence in the pituitary system secretion adrenocorticotropic hormone. This hormone influence adrenal system and secretion and cortisol, and after cortisol have metabolic effect and etc. With an increase in catecholamines and glucagon and glucocorticoids, there is an increase in glycogen glycogenolysis and gluconeogenesis, lipolysis, proteolysis. In the blood, glucose, amino acid, free fatty acid increase, insulin, somatotrope hormone, somatomedins, thyroid hormones increase, the anabolic effect. If an increase in the concentration of hormones is observed for a long time and accelerate, and then pathology in the body is formed. Glucocorticoids have an anti-inflammatory property, and in time phospholipase A2 is inactivated, and cyclooxygenase 1 doesn't form, and gastric ulcer developed. And next, under glucocorticoids increase hydrogen chloride, and next gastric ulcer develop, and under glucocorticoids reduce proliferation and regeneration property of the cell and form stomach ulcer. Next, glucocorticoids are immunosuppressive activity. And
stress-limited systems. There is a system that limits stress, and it is called the anti-stress mechanism of the body. Consists of central and peripheral system. Central system including gamma amino fatty acid system, inhibitory neurotransmitters, inhibits the activation of the sympathoadrenal and pituitary adrenal system. An apiatergic system including endorphin and enkephalins. Endorphin reduce of activity of feeling pain. Enkephalin and are formed in neurons of cerebral hemisphere, hypothalamus, adrenal cortex, and etc. Apiastic form even in T lymphocytes. They cause an analgesic and euphoric effect, normalize blood pressure. Apiastic reduce glucocorticoids, catecholamines, and increase somatotrope hormone and prolactin. Dopaminergic system include neurons, black substance, hypothalamus, striatum, and etc. They weaken the stress mechanism. Activation of the serotonergic system, increasing the synthesis of corticotropin and vasopressin. The pineal gland stimulated the secretion of opiate substance. Epiphysis deficiency reduces melatonin. Melatonin is an activator of antioxidant system. Melatonin and non-epinephrine reduce stress. Melatonin and serotonin provides a circadian rhythm of corticotropin. Circadian rhythm is body temperature varies depending on the time of day. And peripheral system including prostaglandins, antioxidant system, stressor proteins. Prostaglandins are the vasodilation that reduced blood pressure, compensators for diuresis, reduce the lipolysis and effect of catecholamines. And prostaglandin E reduces the secretion of non-epinephrine and decreases the activity of the central nervous system. Catecholamines, with the help of beta analgesic receptor, increase cyclic adenosine monophosphate and stimulate the formation of prostaglandins. Adrenergic system increasing the secretion of prostaglandin by feedback, decreasing the secretion of catecholamines. Next, antioxidant system. Next, stressor proteins normalize the violation of thermoregulation, increase cellular resistance to hypoxia, and etc. Thanks for attention. Take care.